Hi, my name is Ashley Moore, and I'm going to give a speech on ADHD, how they were diagnosed wrong with medications. I'm from Speech 1110 online. My audience is Alex, David, Dee Dee, and Tanisha. Children who are diagnosed with ADHD are labeled as an ADHD child, even though they might not really have it. These children are given medications for ADHD, and they really do not have ADHD, that children are adversely affected by the medication in society. This paper is going to prove that too much medication is harmful to children. There are many other effective treatments for ADHD children. ADHD is attention deficit hyperactive disorder. This disorder is described as a problem for children who are overactivity, impulsivity, inattentiveness, or a combination of all three. Behavioral symptoms include, but not limited to, short attention span, tantrums, inability to sit still, fidget, difficult playing quietly, interruptions, and easily distracted. Symptoms include slow learning and reasoning ability and dyscalculia. Social symptoms include tendency to interrupt, difficult awaiting a turn, difficult in getting along with other people. And muscular symptoms include poor motor control and a tendency to be accident prone. Children with hyperactive symptoms fidget, they leave their seat unexpectedly, always on the go, and the children have difficult playing quietly and always driven to go. Impulsivity symptoms include blurting out answers before questions have been asked. Children have difficult waiting their turn and always interrupt conversations or games. Children who fail to give close attention to detail or make careless mistakes on homework or do not even listen when someone is speaking are all symptoms of inattentiveness. ADHD is not a simple diagnosis. There is no laboratory test a child can take. The children needs to have numerous ADHD symptoms, and if the symptoms are serious enough to cause a significant impairment to the children. The symptoms need to be chronic in nature. An evaluation takes time. An evaluation may consist of parent or teacher questionnaires, evaluation of the children and family, including IQ tests, psychological testing. The physician to evaluate a child for ADHD need to be qualified. A professional child psychiatrist, pediatrician, social workers, and family practitioners are all qualified to diagnose ADHD. Also, people who are specialized in childhood medical and mental health issues are also qualified to evaluate a child. Stimulant medications used for ADHD along with antidepressants. Some stimulant medications are Ritalin, Concerta, Adderall, Dexatrin. ADHD disorder in children, treatment and drugs are all stimulant drugs are available in short-acting or long-acting forms. With the short-acting medications, they only last for 4 hours, while the long-acting medications can last anywhere between 6 to 12 hours. The patch can be, or the Ritalin patch can be worn on the hip area, and it delivers medication for approximately 9 hours. This drug is approved for children ages 6 to 12. It usually takes a couple weeks to find the right dose of medication for your child. These stimulant medications boost the neurotransmitters in the brain. These stimulants also should assist with the symptoms of impulsivity and hyperactivity. Behavioral treatment can be included along with medications. These children need positive reinforcements from parents and family members. Counseling also helps ADHD children. Medications affect children differently. Some ADHD medications can cause sudden death. These would include cardiovascular issues. The medications can cause a stunt in growth and also magnesium deficiency. Plus, they stunt growth. Children who had never taken stimulant drugs were on an average of 6 pounds heavier and are children taller than 7.5 inches, the same age who have been taking drugs for 3 years. This height and weight differences was permanent. Children who have had taken ADHD medications are linked to magnesium deficiency. Stress is a factor with ADHD children. These children are subject to loud music, school exams, peer pressure, sports practices, and body image. Children with ADHD who have stress seem to escalate because the children cannot handle so much activity all at once. Poor nutrition is a factor for magnesium deficiency. Children who are eating more processed foods, sugar, and food additives. Unhealthy eating causes the body to use up magnesium. Magnesium relaxes the mind. Magnesium is used to calm the nervous system, which is doubly important in children with hyperactive disorders. When children have the appropriate amounts of magnesium in their system, it can provide a feeling of calm and well-being. Magnesium relaxes the body. Magnesium helps the muscles to relax. It takes away the twitches and spasms that are common with ADHD children. When the children's body is calm, it is easier for the children to behave calmly. Children can take magnesium supplement or by eating more foods rich in magnesium. All children who have a cardiovascular disease need to be monitored very closely if they take ADHD medicines. The American Heart Association clarifies in the statement on cardiovascular evaluation and monitoring of children and adolescents with heart disease receiving medications for ADHD states that medications that treat ADHD have not been shown to cause heart conditions, nor they have been demonstrated to cause sudden cardiac death. However, some of these medications can increase or decrease heart rate and blood pressure, which these are not usually considered dangerous. They should be monitored in children with heart conditions as the physician feels necessary. Some children abuse their ADHD medications. The article from J. Clinton Psychiatry states, that 2 in 10 youths with ADHD misuse their medications. Physicians need to realize the motives for drug abuse and misuse of medications when treating patients for ADHD. There are drug and alcohol screening questionnaires that the physician may have their patient take if the subject misuse of medications. Another article from Medscape states physicians who treat patients with ADHD need to be aware of both the behavioral and medical signs of substance abuse and closely screen their patients for SUD, which is substance use disorder. There needs to be further assessment done by the physician to make the patient so they do not abuse their medications. There have been numerous calls to the poison control centers that relate to ADHD drugs. Poison control call centers have kept statistics showing that teenagers who take ADHD medications show the abuse has risen 76% faster than calls for teenagers of regular substance abuse. There have been worries that ADHD drugs are being overused instead of the possibility of side effects. There are more children taking ADHD drugs to get high. These stimulant drugs are a mixture of methylphenidate and salts. Both of these medications put together and not in a controlled environment can cause these children to experience euphoria or high-like symptoms. More children are misusing their medications because more have direct access to the medications. Having hallucinations are not uncommon for these children. Some children hallucinate. They see snakes, worms, or even insects crawling all over them. All ADHD medications are psychoactive drugs with possible side effects. Children who are labeled as ADHD children have a feeling of confusion because they do not understand why they are being treated differently. A lot of ADHD children are treated as having a bad behavior. Teachers treat ADHD children differently. The teachers were given a description of a children with a label of ADHD or no label of ADHD or a label of ADHD with stimulant treatment. Children who are diagnosed with ADHD have many challenges ahead of them. Their parents will need to be there for them. Parents need to be aware of the possible side effects of the medications and know what medications their children may be on the right now to make sure the medications do not counteract each other. Parents can seek help with behavioral specialists or psychiatrists. Parents will need to be sure that their children really have ADHD and seek proper treatment.